Hi, this is Dr. Alexandra Reed with the National Animal Disease Traceability and Veterinary Accreditation Center, and this is the ADT Cooperative Agreement Webinar Training. Thank you for joining me today. In 2018, the USDA established 4 overarching goals to advance animal disease traceability. First, to enhance the electronic sharing of data. Second, to increase the use of electronic ID tags for animals requiring individual identification. Third, to enhance the ability to track animals from birth to slaughter. And fourth, to increase the use of electronic ICVIs. As part of submission of an ADT Cooperative Agreement request, recipients need to draft an ADT roadmap. The roadmap should provide the recipients vision, long-term plans, and objectives for implementing the ADT program. Please contact your AVIC program manager or traceability@usda.gov to receive a copy of the ADT roadmap template. The roadmap must be current and approved to be eligible to receive ADT Cooperative Agreement funding, and must be updated a minimum of every 3 years or more frequently as necessary to accurately reflect their approach and implementation solutions to advance ADT. There are 6 key activities that need to be detailed in the ADT Cooperative Agreement Work Plan. The first is the administration of official identification devices. Advancement of ADT requires activities that will make electronic information more readily available. Technology such as RFID tags, readers, and associated electronic interstate movement documentation must be given high priority in the work plan. In the work plan, please explain how official ID will be made available to producers and plans for increasing the use of official RFID tags and reading devices. Explain how the RFID tags will be read electronically and data collected after the initial application of the tag to ensure the technology is well utilized. Secondly, please explain how the recipient is maintaining records of official identification devices distributed and/or applied to ensure timely retrieval of such records when needed, including devices administered through accredited veterinarians, markets, tagging sites, etc. See the ADT Workbook Quarterly Reporting tabs to report the number and type of official identification devices distributed and/or applied. Here is a screenshot of the official identification devices chart located in the ADT Workbook Quarterly Reporting tabs. This is where you record the number and type of official identification devices distributed and/or applied, as well as the species they were applied to and the number. The second activity is electronic records. In addition to the key elements noted in the ADT roadmaps, activities to increase the volume of electronic records that optimize the searchability of potential ADT data should be described. Priority areas to consider include distribution records, tags applied records of official ID, interstate certificates of veterinary inspection, and other sources deemed applicable for the recipient, things like data from bovine brucellosis vaccination and testing, bovine tuberculosis testing, brand inspection certificates, etc. The work plan must describe the recipient's approach to increase and track the utilization of electronically searchable ECVI systems by accredited veterinarians. See the ADT Workbook Quarterly Reporting tabs for reporting the number of paper and electronic ICVIs issued per species covered under ADT, and the number of Category 2 accredited veterinarians using ECVIs. Here is the ICVIs chart located in the ADT Workbook Quarterly Reporting tabs. This is where you record the number of paper and electronic ICVIs issued by species, as well as the number of Category 2 accredited veterinarians using ECVIs. The third activity is information sharing. Sharing information quickly and effectively will help APHIS and its recipients respond to animal disease events and make ADT successful. Specifically, the recipient should explain what information systems are being used to support traceability and describe the process and in what format APHIS and other states will be provided access to the data when needed. Recipients must include a description of systems utilized for the distribution of official identification, program disease, and movement record keeping. Contributing summary data from state traceability systems to AHR, or the Animal Health Event Repository, is encouraged as a way to improve all states' ability to trace disease. Therefore, cooperators should include a plan for sharing data with AHR from their systems supporting traceability and timelines for implementation. If cooperators are not able to share data points with AHR, please explain the reasons why. Recipients who have developed or obtained their own information systems should explain how their systems are aligned with established data and communication interfaces to ensure compatibility of information systems. The fourth activity is outreach. Implementation of an outreach plan for the recipient's approach, including timelines and goals, is vital to support ADT. Recipients should focus on outreach events with stakeholders that demonstrate the value of ADT, including understanding of electronic animal ID, premises ID, timelines, regulations, and exercises demonstrations of real-world scenarios. Recipients are encouraged to conduct tabletop exercises in cooperation with federal personnel and use models, resources provided by APHIS. See the ADT Workbook Quarterly Reporting tabs for the reporting of ADT outreach activities. A screenshot of the outreach chart is shown here. The fifth activity pertains to national priority traces. So, to give some background, ADT is a performance-based program. The trace performance measures, and more recently, the national priority traces, have been used to measure and document progress. The NPTs are based on 4 defined trace performance measures, which evaluate a recipient's ability to properly administer, record, and retrieve documents pertaining to official livestock identification and interstate movement. Guidelines for the administration and completion of NPTs should be followed to maintain eligibility for reimbursement of expenditures. The recipient's work plans must detail the following elements for NPTs. They must provide an overview of how the recipient will complete the assigned NPTs in the Emergency Management Response System, or EMRS-2. Cooperators will be informed of their performance in these exercises each cooperative agreement period. If issues have been identified, cooperators should work with their area veterinarian in charge program manager to provide key actions or activities that they plan to take to continue to improve prior to the next performance period. The sixth activity is compliance and enforcement. High compliance with traceability regulations is also critical to achieve optimum tracing capabilities. While APHIS is the lead on regulations defined in 9 CFR Part 86, the ADT rule, recipients are encouraged to work cooperatively with federal resources on activities that will support compliance with and enforcement of ADT. Specifically, first, please summarize the most common ADT compliance issues and efforts being made to improve them. And please notify your program manager of any issues that may warrant an investigative and enforcement services, or IES, investigation. And second, please ensure that accredited veterinarians and other tag managers who acquire official identification devices directly from manufacturers keep accurate records of tags distributed and applied. Recipients must document efforts that will be taken to ensure compliance with this requirement. Recipients are required to submit an ADT detailed financial plan. it is recommended that recipients use the ADT Cooperative Agreement Financial Plan Excel template to document planned expenditures, which is found in Appendix 7 of the Veterinary Services Field Operations Grants and Cooperative Agreements Guide. Lastly, a quick overview of the Program Manager checklist, which is filled out by the AVIC Program Manager and submitted to ADT staff along with the work plan. In completing this checklist, the Program Manager confirms that all the required criteria are met in the recipient's work plan. Reviews history of accomplishment, so has the recipient successfully met the goals and objectives from prior years. Confirms the recipient's roadmap is current. Roadmaps must be updated every 3 years. And reviews the 6 activities I've just covered to make sure they are fully addressed in the work plan. Lastly, the Program Manager provides a score between 0 to 10 for each of these areas. And that concludes the ADT Cooperative Agreement webinar training. If you have any questions or comments, please email traceability@usda.gov. Thank you for listening and have a great day.